Kenya is the first country to host this meeting outside of WHO headquarters in Geneva. And this indeed is a testament to the strong bond of friendship and collaboration that we continue to share over the years, and speaks to even greater cooperation between Kenya and the WHO as we seek to individually, but also collectively, achieve our goals and aspirations. The global health community, and indeed the sub-Saharan African region in particular, has recorded remarkable progress in key health indicators towards the health-related sustainable development goals, especially in regard to reducing under-5 mortality, increasing the coverage of HIV treatment, and reducing the causes of death from tuberculosis. However, we must admit that we continue to grapple with addressing the social determinants of health, poverty, and inequality, in addition to the persistent health challenges such as weak health systems, malaria, drug-resistant tuberculosis, mental health, all of which could very easily erode the gains that were made during the MDG era. Indeed, I've been informed by my minister that this meeting is of utmost importance to the World Health Organization and to the entire global health fraternity as you commence the implementation of the 13th Global Program of Work, 2019 to 2023. Let me also say that the theme of this meeting resonates very, very well with my administration's agenda for development. During my inauguration for my second term in office last year, I prioritized the attainment of affordable health care for all as one of the big 4 priorities for my government for the period of 2019 to 2022. This, ladies and gentlemen, is in line with Kenya's new constitution, which makes it clear that every Kenyan has a right to affordable health care that is of quality and is also responsive to their needs. Over the past year, my government has progressively increased financing for health sector and implemented various initiatives aimed at promoting equity and targeting the most vulnerable amongst our population. Most notably, we continue to offer free maternity services to Kenyan mothers in public and faith-based facilities, and we have also eliminated user fees in all public primary care facilities, coupled with the introduction of programs such as the Health Insurance Subsidy Program and the scheme covering the elderly as well as the severely disabled. Much as we have made good progress in uplifting the health of our people, we too know that gaps still exist in terms of service coverage, quality, and human resources for health distribution across the country. And it is therefore with this realization that we view the attainment of universal health care not as a destination, but as a continuous process which will involve constant widening of the social safety nets to ensure that we leave nobody behind as we strive to achieve our national health aspirations. I believe it should concern all of us that nearly half of the world's population still do not have full coverage of essential health services, and that almost 12% of the world's population spend at least 10% of their household budgets to pay for health care. Every year, 1 million Kenyans are driven below the poverty line by health-related expenditures. Poverty predisposes vulnerable Kenyans to disease and slows aspects of our growth in our economy. Therefore, to make universal health care a reality by 2030, we must sustain the momentum generated by the MDGs in order to attain our SDG targets. SDG 3 aspires to ensure health, universal health care, has a strong focus on primary health care and to the fundamentals of health promotion and disease prevention, addressing determinants of health. This, we believe, will yield a more sustainable universal health care model for Kenya. And I today wish to extend an invitation to all of you who can to join us Kenyans on the 13th of December, a day after our Independence Day, in Kisumu town on Lake Victoria, as we launch the Universal Healthcare Pilot. And to this, Dr. Tedros, and indeed to the entire WHO community, we thank you for the support that you have given us in getting us to where we are so far. As I conclude, good friends, I take this opportunity to wish all of you very fruitful deliberations over the next 2 days, and it is my hope that your deliberations will translate into tangible benefits for the entire global community.